Western Australia will provide free rapid antigen COVID tests to every household as infections continue to rise throughout the state. An additional 10 rat tests will be included as part of the next phase of WA's free rat program. Families will be eligible for a total of 15 rapid antigen tests until March 17th, which will be delivered by mail. They'll also be on offer at public sites, including at train stations. WA recorded 4,307 infections in the latest reporting period. Let's bring in now the Australian Medical Association WA President, Mark Duncan-Smith. Appreciate your time, Doctor. Give us a snapshot of the current situation in Western Australia. Obviously, going into this outbreak with such a high vaccination rate, it made the state something of a guinea pig in terms of COVID manager. How's it travelling?
Look, we're actually doing very well as far as everything goes, where numbers of hospitalisations are significantly less than otherwise would have been predicted. And most importantly, the number of patients in intensive care unit care is way, way lower than expected. I think there's only a handful of patients at the moment. There's been several patients go into ICU, several patients go out of ICU. And that's probably running at about 5 times less the rate than we expected. And there's lots of factors at play here, which also include the access to the intravenous antivirals, the oral antivirals, the fact that we've got very, very good hot weather here in WA recently. All of this is contributing, including obviously the very, very high vaccination rates, and the 70% boosted is where we're at the moment. All of this is contributing to what looks like a very, very good outcome for Western Australia and Western Australians with COVID and Omicron.
So when is the peak of this outbreak expected?
Well, unfortunately, the government in WA is keeping their modelling very close to their chest. They've released some of the modelling, but they haven't told us exactly when day zero was. So according to the government, it'll be this week. Some doctors who are doing their own modelling are expecting it either late this week or early next week. We are hoping, and the government tells us that we're on track to keep the peak number to 10,000 cases, new cases per day. Now, if we are able to do that, then they're predicting only about 400 people in hospital at the peak, about 50 to 60 people in ICU at the peak. But again, we may only see 10 or 20 in ICU at the peak based on the way that we're travelling at the moment. So everything is actually looking very good for a very soft landing for WA. And that 70% boosted rate, I think, is really protecting us. Remembering that a boosted patient has 98% protection against severe Omicron disease.
We know the WA Premier, Mark McGowan, has taken a very cautious approach to COVID management throughout the pandemic. Is he now being overly cautious? Is it time to end restrictions, considering things are looking so good in the state?
Well, no, I don't think it is time to end restrictions at the moment. I think the time to end restrictions is when we get over the hill, when we get over the hump of the peak. I would really want to see us to know that we're over the peak before we ease restrictions. We've seen it in the eastern states where they started to back off on restrictions in what I would consider too early, and there was a big upswing in cases. So no, I think we definitely should keep the restrictions where we are at the moment. They should wait until we are definitely over the peak so that we know our medical system isn't going to get flooded. And then as soon as possible, to ease the pressure on businesses and allow the economy to recover more, then those restrictions should be lifted. But remembering that WA for the last 2 years has pretty well been functioning completely normally. In fact, our economy has been absolutely booming, but we would want to get rid of those restrictions as soon as possible, but not until after the peak.
Mark, just on a national scale, I see the Australian Medical Association is launching something of a pre-election attack on the coalition over delayed healthcare reforms. What is the strategy? How are you going to increase pressure on the government in the lead up to the election? Does the government deserve a bit of a break? Because obviously some of those healthcare reforms have been stalled while they've been managing the pandemic.
Yeah, look, what we're pointing out to the public of Western Australia, is that the federal government did promise in 2019-2020 to create a 10-year plan for GP and primary care reform. And this was to allow modernisation and, most importantly, sustainability of primary care. Now, they unfortunately have not come through with that. They've made comments like there's been significant investment in primary care due to COVID, with vaccinations, with COVID care, and also with telehealth. But this isn't actually investment in long-term primary care. This is investment in dealing with COVID in the here and now. So we certainly are calling on them to keep up their side of the deal, which was basically to reform primary care, to support it better, to make it sustainable, and make it attractive to young doctors. At the moment, the young doctors are not interested in primary care because it just quite simply isn't well enough supported by the federal government.
Dr. Mike Duncan-Smith, appreciate you joining us live there from Perth. Thank you.
Great to be with you. Bye.